I'm Dr. Heather Moore, owner of Total Performance Physical Therapy. Today we're going to talk about relief for hip bursitis. So there is a bursa that sits around a lot of your joints, one of them being the hip joint, which is right here. And that can become inflamed and it can make painful sitting, standing, walking, and it's important that you address bursitis before it becomes anything worse. And the problem is that bursitis in and of itself can probably be tolerated. Sometimes it can get bad enough that it's not tolerable, but what happens is you start to limp, and you may not even know that you're limping. You just change how you walk. And that will affect your back, your knee, and your ankle. So it's really important that if you do get diagnosed with bursitis, that you do address it, not just through changing how you walk, but how you actually, doing things to relieve the bursitis. It is not something that you just kind of say, oh, well, I have bursitis, I don't have to worry about it. It is something that you do want to treat and address. So just kind of a heads up on how you can deal with bursitis and not know you're dealing with bursitis through that limp or that change in how you walk, and that will actually become worse than just dealing with bursitis. So bursitis generally is due to tight muscles that start to rub, is one of the causes of it, and that's what we're really going to address today, is bursitis that's caused by tight muscles, and how we can relieve that. So one of the things that we're going to do is really just work on more of a standing posture. So with bursitis, a lot of times it's going to hurt when you walk or when you stand, usually more so when you walk, going up and down the steps as those muscles rub. But you want to make sure that when you are standing or sitting, that you are, first of all, changing your posture often. So when you are standing or sitting or standing in a static position, just like I am now, for too long can be harmful. So whenever you're standing, especially if you have a bursitis, you want to constantly be moving, okay? Even if it's a side-to-side movement, even if that hip may be a little bit sore as you put weight on it, you want to be constantly moving, because that's going to increase blood flow to the muscles, to the area, and allow some of that inflammation to calm down. The more you stand still and you stand static, you really have a problem in that blood flow stops to diminish to that area, which then can actually cause it to really start to ache. So a lot of times people will report, if I sit for long periods of time or stand for long periods of time, that bursitis really acts up. And that's because there's no real blood flow going to the area. But when you move around and you actually force blood into the area, that's going to help relieve some of those symptoms. So while, the one thing people want to stop doing, which is movement when they have bursitis, you really actually want to do a little bit more, and that comes with just standing and moving around as you stand. As you see, it's not a whole lot of big movements, but it is important that you just continue to move while you're standing. The next one we're going to talk about is a figure 4 stretch. So there are several ways you can do the figure 4 stretch. I am standing right now, so I'm going to show you how to do this in standing. You can do this laying down, you can do this sitting, you can do this any way you want, but really the idea is that your leg crosses over your knee, and then you can sit down. You're going to feel a stretch in your hip, okay? So that is the idea. So it doesn't matter, you should actually do this both sides, but you're just going to figure 4 those legs, okay? And then you can sit. If you're standing at like a countertop, you can just put your leg up on the counter and do this. This is often done sitting and laying down, but I want to give you some of those standing options to do. Same thing, other side. You're just pulling that leg up, okay? You're not necessarily twisting. I was just twisting to show you, but you're just going to stand here, and then you can lean forward, hinging at your hips, okay? But that's a quick way to stand and do that figure 4 stretch. Like I said, again, you can lay down and you can do it sitting. We obviously don't have that ability all the time, so that's a way you can do it standing, especially if you're in line or standing around and that bursitis acts up. Really important that you do that. The next one is going to be a IT band stretch. I am not a huge fan of an IT band stretch because it is a fibrous part of your body, really almost impossible to stretch, but people really try and do this stretch because it's on the internet, so people really can tweak themselves doing it. It will stretch the outside of your hip, so it's not necessarily a waste of time, but if you're going to do anything with the IT band and you're specifically looking for IT band relief, that's more on the foam rolling. And if you look at our channel, Total Performance Physical Therapy, we have several videos on that you can do. But for this, you're gonna stand, and I usually say stand up against the wall, and you're gonna cross your leg over now, and then you're going to go up and push your hip up against the wall. If you want a little bit more of a stretch, you can cross the leg closest to the wall over, and then push your hip into the wall. The idea is that you're gonna feel a stretch all the way down the side of your leg into your knee. Now, if you have low back tightness, if you have other tightness in other areas of your hip, you're gonna feel that stretch there more. So what I often see common mistakes are people really turning their body and really forcing this stretch, and it should not be stretched in a manner that requires you to turn and to twist and to do all sorts of different things in order to achieve the stretch. You should just be able to put your hip up against the wall nice and easy and stretch it out. If you or someone you know is suffering from bursitis, hip bursitis, or any other bursitis, and want a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898, and we'd be happy to get you in.